thank the people who saved my life. My wife, Gianna G, who has a very, very stubborn husband and did not want to go to the hospital because I just had a cough and didn't think anything of it. And we both had COVID at the same time. And, I was a few days behind her and everything was going. My first day was her first, everything matched up, everything. And we both got a cough on day 6 or 7, and her cough went away in a couple of days. Mine just didn't. And then when she was seeing it was getting too bad, she told me I was taking me in, and I'm like, I'm not going to the hospital for a cough. And called Dr. Colucci, who has known him from my Red Wing days, and who's actually become a really close friend and personal friend. And he advised my wife to just get me to any emergency room on our side of town. And I'm like, nope, if you're taking me, I'm not gonna need to go see Doc. And as soon as I got there to Henry Ford, their staff that took over, Dr. Colucci, Dr. Hussein, the whole ICU team, the professionalism and everything that they did from when I got there to getting me upstairs to chest x-rays and finding the blood clots within the hour. It was amazing. And then when that ICU team took over, it was the professionalism that they have and everything that they were doing. It was top notch, and I couldn't figure out a better way. And now we're in the world of social media to thank these people who saved my life. And if it wasn't for my wife, Dr. Colucci, Dr. Hussein, and the ICU team, I know for a fact I wouldn't be here sitting here right now. And that the professionalism from top to bottom, it was absolutely amazing.
Well, Manny, thank you so much. Thank you for those comments and sharing your story with us. I'd like to turn it over now to Dr. Colucci, our medical director of Henry Ford Macomb Hospital Emergency Department. And Dr. Colucci, who's also the Red Wings medical director and a longtime family friend, as Manny just mentioned. I'm going to go ahead and open up your mic, Dr. Colucci, and we'll let you tell us about how you handled Manny's case.
Okay. Can you hear me?
We can. Thank you.
So, kudos to G, because somebody had told her during this period of COVID, when Manny wasn't improving like she did, and it appeared that his course was going longer than hers, somebody had advised that, to get a pulse oximeter. And she went out and purchased or went and got a pulse oximeter, which kind of led them down the path with, hey, his oxygenation's 83%. They called the Columbus Blue Jackets physician, who then contacted me, and then I said, you mind if I call him? And then, because I didn't know where Manny was. I didn't know if if they were in town or if they were out of town. And he said, no, they're at their home in Detroit. I said, okay, then let me call him. And then, like Manny said, when I was discussing, I said, well, at 83%, she said he was struggling for the last 3-4 days, sitting up, sleeping, not able to lay down. I said, okay, this is bad. So it's been going on for a couple of days. Didn't know if the amount of days and hours of being hypoxic, what effect it has had on him at this point. So I said, you're probably wise to go to the nearest facility, get him to get oxygen ASAP. She assured me that he's not short of breath, but yet they felt better, that he'd be better coming out to me, which was about a 55 minute drive, Manny?
Yeah, exactly what it is, 55 minutes.
So anyways, when Manny came in, I met him at the door, had G wait in her car in the parking lot as our, we had restrictions at that time for COVID. So I brought him back, and when I walked him back, immediately put the pulse oximeter on him, he was at 75%, which cannot sustain life for a period of time. So once we sat him down, put some supplemental oxygen on him, we got him up to I gradually went up to 77, 88 is what I could get him up on 8 to 10 liters of regular nasal cannula, and he wasn't moving much. Then we put him on high flow, and had him in his own private room, and got up to, I think, low 91, 90, maybe at the max. And then respiratory came to me, and we immediately, and this happened within less than 30 minutes. Just trying to graduate, because I know he was deprived for several days now, his brain and his heart and other organs, of oxygen for the period of time. Got him up to Venmo pretty quickly, where he was sitting at 97, 98%, at which time, we initiated our COVID protocol, which includes a CAT scan, which, showed evidence of the COVID pneumonia, along with bilateral blood clots, which does come along with the disease of the COVID. But we initiated treatment right away. I contacted Dr. Hussein, infectious disease, on my way in, actually. And as soon as he said, once you see him, call me and you get the, so as soon as I got out of the room, like I said, it was a matter of 30 to 45 minutes, along working in conjunction with Dr. Waterfield and Dr. Fulmer, that kind of orchestrating the whole process with our nursing staff and techs and everybody, to be able to say, start the medication and treatment plan, which the sooner you get it going, the better it's going to be and better outcome for Manny. And which it all, just like I said, for as bad as he was, and I think he's realized it because he's heard it enough from me now, that how bad he was and how lucky he is that he's with us today, that the scale could have tipped at any moment while he was struggling, sitting up, breathing. He could have been tipped over into a pretty catastrophic cardiac event because of the low oxygenation. So he, like I said, he dodged a bullet, and I'm honored and glad and blessed that we were able to help him get out of there.
Thank you, Dr. Colucci. I want to ask Manny here on the, on the heels of your recap. How do you feel today, Manny?
I feel good. I was today was probably the most I've done in a while. In about 3-4 weeks. It's our second day of camp, and we had 3 ice sessions, and I didn't make the final ice session, but I have some great staff that in our goalie department here that helped me out. But yeah, every day is getting better. Every day. It just seems like the lungs are starting to come back a little bit. Still zero energy, still fighting, and Doc said it's going to take a while, but it's coming back.
Great. That's
very, very lucky.
Great to hear, Manny. Thank you for that. So at this point, I want to open it up to questions from our media outlets who have joined us. So go ahead. If you have a question for Manny or Dr. Colucci, please go ahead and virtually raise your hand, and I'll go ahead and open your mic, or you can type your question in the chat and I can go ahead and read it out. I've got a question already here. Let me see. I've got Kristen Seamus, and I'm going to open up your mic, Kristen, and please go ahead and Kristen's from the Free Press. Go ahead with your question, Kristen.
Thanks so much for letting me talk to you guys today and for doing this with us. Manny, could you talk a little bit about how the disease progressed in you, how it started, what your first symptoms were, how it progressed until you felt like you needed to go to the hospital, or your wife did, and also a little bit about whether you had underlying health conditions. I mean, you're a pretty young guy, right?
Mm-hmm.
So
yeah.
talk a little bit
youngish.
about that, please.
Yeah, I'm youngish. I'm 48 years old.
Yeah, I'm a year younger than you, so I feel like you're a young guy.
Well, thank you. Yeah, so it's there was an outbreak down here in Columbus a little bit, and one of my friends who had a baby, we were watching their dog, had emergency C-section, and took it over there, took their dog back when they got home, and hung out with them, saw the baby, hung out with them all day. When we were leaving, he said he hasn't been feeling good at the hospital, getting the chills and stuff like that. And we're like, oh, okay. Then he went and got tested that night, and it was COVID. And my wife the next day started getting the symptoms. She got tested on Sunday night, she was positive. We drove back to Michigan. And then I got tested on the Tuesday, and I was positive. My symptoms didn't start till Tuesday night, Wednesday morning. So like I said before, for the person we got it from, my wife, everybody was on that same path of first day you had this, second day you had that. And it was just the first week we were laughing at it because I knew exactly what I was day 3, this is what's going to happen to me. And sure enough, it happened. And then by I think it was day 6 or 7, that's when the cough started. And that's when their cough started. And both of them flew right through it. My buddy who his temperature got up really high to like 104. But we were lucky. My wife and I never hit the 100 mark. And then it just progressed from there where the cough just got worse and worse. And I get a cough when I get allergies in the spring. So I just figured it was another load of that was just happening, and my cough just kept going. And me being stubborn, just like my old man is stubborn and my brother's stubborn, and I don't need to go to the hospital for a cough, is the stupidest thing I've ever done in my whole entire life. And if my wife didn't do what she did and get a hold of the people she got a hold of, I wouldn't be here talking to you. And and Henry Ford Macomb is saved my life.
Thank you, Manny. Appreciate that. We got a question in the chat, and Deanna, your mic's open. If you want to ask your question, go ahead. Otherwise, I can ask it for you. Okay, I'm not hearing Deanna, so I'll go ahead and ask the question for her. Deanna Lights with WWJ News Radio. Deanna wants to know, Manny, many people in the hospital are unvaccinated. What made you wait to get vaccinated?
So my wife and I, or my wife, I should say, has been going through a lot of health issues over the past 5 years. We've seen specialists, we've seen everything, we've seen every doctor under the sun over the last 5 years where her symptoms, it was not good, and got really scary there for a couple of years. And now she's starting to make that turn and make the where it's coming back to normal and everything's starting to level out, and the disease hits. And this vaccine's new, it's still not a year yet. Her doctors were just, let's just wait. Both my kids are vaccinated, so it's not like we're against vaccinations. We are not. It was more of, they didn't want to give it to her for her to have a relapse into her immune system and everything. They just didn't know where it was going. They just wanted to see the data as it was coming out. And we are far from non-vaxxers, or whatever they call people these days. NHL, and now one of the side effects was blood clots, which you're hearing online. It was blood clots. My dad, who almost died from blood clots in 2005, so he's been on heavy blood thinners since 2005. He got the blood clots again in 2016, got the blood clots again in 2017, and 2018 he had cancer of the kidneys, and my brother and I had to go to the hospital to see if they had to take both kidneys or one kidney. So it happened to my blood type, and his blood type matched, and it would have been one of my kidneys if they would have took both kidneys. And so it was just more of a wait and see. And then the NHL did our mandates for the vaccination. So for a week, I was talking to every doctor I could possibly get a hold of, all our doctors here, all my dad's doctors back in Canada, all the reports. They took so much blood out of me for a week to make sure that I was healthy enough to get the shot. And we had it planned for September 1st. That was our plan. The team doctors here in Columbus had booked our team. Mr. Vogt, he planned it for me, and then I got sick. And it just was bad luck that I ended up getting sick and wasn't able to get things done. Now, Dr. Colucci along with Dr. Winnett at the NHL, Dr. Ruan here, have put in a protocol for me and the NHL and the NHLPA to get the vaccination when they think I'm going to be healthy enough, and the proper time to, Dr. Colucci could talk more about it when it is the right time and all that stuff. But I'm leaving it in their hands now to, when they say it's time to get the shot, I'm getting the shot.
Great. Thank you for that, Manny. Appreciate you answering that question. Looking for more questions here. Let me see. I see another hand up from Kristen. Kristen, I'm going to go ahead and open your mic. Go ahead, Kristen.
Thanks. Could you tell us how long you were hospitalized and sort of what went through your mind as you made that drive to the hospital? I presume you came from Novi to Macomb?
I did. I was in the hospital from Monday to Sunday, so 7 days. The drive was like I said, I'm stubborn, like to a fault, obviously. It almost cost me my life. It was still kind of like, oh yeah, I'm glad I'm going to see Dr. Colucci so he can straighten it out for my wife, that it's only going to be this cough and this is what's going to happen. And once I saw it with Doc, and I was like, oh, this is serious. This is really serious, this disease. And I knew the disease wasn't a joke because we were sick for probably 5-6 days, like seriously sick for 5 or 6 days. But when I saw him and I saw his eyes looking at all the numbers and all that, I was like, yeah, this is really serious. And I went to the right place. I can't say it enough. I went to the right place from top to bottom. And it's not just, saying this because Dr. Colucci is a friend of mine. After I left the ER, he came and checked on me, but the people in the ICU, Dr. Hussein, the professionalism there was bar none, in my eyes, bar none.
I want to ask jump in and ask Dr. Colucci a quick question here. Manny just talked about your friendship, and obviously when Manny came in to you, he's just another important patient in ER, and this is the same kind of care you provide every patient that walks through the door. So talk about that a little bit.
Well, ER medicine, you get either a radio call, you get some kind of a heads up and triaging on people. And my heads up was a phone call from the team physician from Columbus, a discussion with Chief. And then when he got there, and I got some form of vital signs at home at 83, so I knew it was problematic right from the get-go. And again, our job, what we do, we're made that way, that I just started getting the skids all greased, getting ready for this process, because I said, and again, thinking that he's at 83, he's going to drive in a car, he has no oxygen tank. Where is he going to be when I see him? And it just all matched up. So I didn't expect 75, but he was low enough. And again, I don't care if it's Manny Legace, Bob Jones, Sally Smith, it doesn't matter. We take that same scenario and we do the exact same thing.
Great. Thank you, Dr. Colucci. And Kristen, you have those follow-up questions. If you want to go ahead and ask them, I've opened your mic.
Thank you. Will Manny make a full recovery, or are there likely to be long-term problems? And what is Manny's advice to others when it comes to this disease and the vaccine?
That's directed to me, I'm assuming.
Yes.
So his long-term effects, they're presumed to be, he's going to have a full recovery. He's now on blood thinners, anticoagulants for his blood clots. The disease, will kind of dissipate over time. And again, part of it is the deconditioning, what effect did it have on the pulmonary, along with the blood clots, and then the cardiac status. And we'll be able to see as we move further, and he'll be able to tell us, and we'll get feedback. But the expectation is that he's going to have a full recovery. I think he became kind of with his dad's situation and blood clots, that made him more prone to be, because COVID does come along with blood clots. That's one of the things. That's why we look for it in the whole protocol. But he became more prone because of his family history. And not shockingly that he had bilateral blood clots to the lungs. So that'll go on its normal course. The impact of all the inflammation, everything on the lungs, it's still, this whole COVID thing is still pretty fresh to all of us, and we're just learning each day something new. But the expectation, just by how quickly he recovered, and he's already back to work, that he'll get a full, complete recovery from the COVID.
Great. Thank you, Dr. Colucci. And Manny, just to address Kristen's second question directed to you. What is your advice now, based on your experience about COVID and the vaccine and so forth?
Yeah, I just want to go off what Tony said here is that they said this is the protocol. So it wouldn't have mattered who would have walked into that ER, talking to him and talking to Dr. Hussein and talking to the other doctors in the ER. They're like, this is our protocol. This is what we do. So I didn't get any special miracle drug or anything for walking into that ER. This is the way that they did it, and this is the protocol that they followed, and I was just pushed into that protocol and took over. What would I say? So you're going to get, and I've been asked this question before, is if you look at my parents, my dad, you look at me, the way we grew up was rub a little dirt on it and you're going to be fine. And we're going to go from here, and you don't need to go to the doctors. You don't need to go go to the hospital, go to the ER. Like, it's just, don't be stubborn. And this disease is affecting older people and people with underlying conditions. This is not a joke disease. It really is not. And it's something to take serious. If you get it and you have problems breathing, don't hesitate. Don't wait. You're going to get into doctors' hands like Dr. Colucci and Dr. Hussein, who are going to, if they get it early enough, they're going to be able to help you. If you wait and be stubborn like myself or my dad would be, or my brother, and we wait too long, I almost waited too long, and it almost cost me my life for me being dumb and stubborn. Don't be stubborn. Even if it's nothing, when you go to that ER or go to your doctor, at least you've gone there and made that initial step, because this is not a disease to be joking around with.
Manny, I've got a question that was sent in by the Macomb Daily earlier. They couldn't be on the call, but the question is, as an former NHL goalie, including for the Red Wings, you had to face pucks flying at almost 100 miles an hour coming at you with no fear. What's the experience you've been through now with COVID? I mean, at any time during the bout with COVID, were you afraid?
Well, I was very, especially when they found the blood clots, I was extremely afraid. I was very lucky to make a lot of saves in my career. But Henry Ford Macomb made the biggest save of my life. And their staff of professionals there really made the biggest save in my life.
The other question from the Macomb Daily reporter, and I think you kind of addressed this earlier when you talked about being out on the ice today, but how do you plan to get back in shape now? I know you're a little bit sluggish after coming back from the COVID. Yeah,
it's and during the 3 and a half weeks that I was sick and in the hospital, I lost 30 pounds. So didn't eat there for almost 6 days. And so now it's and our staff here are workout nuts. So our head coach is already bugging me to get on the bike and stuff like that. I'm like, hey, my doctor said I just kind of walk right now to try and build up. So I'm extremely lucky to be part of the Blue Jackets and have the facilities that we have, and the weight room's 30 steps that way. So I'm very lucky to be able to build up nice and slow, and I still walk. If I walk too far, I still get winded and I have to sit down for 10-15 minutes. So I'm a coach now, so I just basically stand there and tell everybody what to do. So there's really no exertion. I just stand out the ice. But if there was a couple times, especially this morning session, where I had to go to the bench and just sit down and relax and not push it by my Dr. Colucci's orders.
Great, thank you for that, Manny. So I don't see any more hands up. If you have a question, this is the time. We'll try to wrap it up here. Otherwise, I don't see any more questions, any hands up or any more questions in the chat. So I will go ahead and wrap things up for us here. Once again, I want to thank Manny and Dr. Colucci for their time today. And I want to give you both kind of a final comment, as we sign off. Manny, what would you like to say that kind of close things out?
Well, thank you to Dr. Colucci. Thank you to Dr. Hussein. Thank you to the ICU team. All the nurses that were there who had to deal with me. They were amazing, every single one of them. Thank you for just making me feel at home, feel comfortable, knowing what I was going through, and they made everything up there easier. And it wasn't easy for about 5 days. It was not easy. And the professionalism that they had up there and the doctors up there they made it easy for me. They really did. And I can't thank them enough. I can't thank Dr. Hussein. I can't thank Dr. Colucci enough. I can't thank my wife enough.
Great.
I can't.
Well, you're welcome.
Thank you, Manny. Thank you. Dr. Colucci, any final comments from you?
Yeah, I just want to tell Manny you're welcome. And I'm a crier, so don't get me crying. And that, for everybody else, that to be wise, be smart. Everybody has their individual choices, and I definitely support vaccination when it's appropriate for your particular situation. Nothing to fear. And to make everybody, like I said, I think what judges a person is how they handle adversity, and Manny's handled this quite well. And I think moving forward, everybody else has to make those decisions and kind of make the decision of what's going to be their legacy. No pun intended.
Thank you. Thank you, Dr. Colucci. Appreciate it. Manny, again, thank you so much. You were a fan favorite when you were here with the Wings, and you still are. You're still make your home here. So thanks again for sharing your story with us, for letting everyone know of the great care you received from our staff. And
Thanks, Sal.
We want to wish you all the best. Everyone here, I'm sure, does. And with that, I'm going to go ahead and wrap things up. And for our media outlets who joined us, thank you for joining us. We will put out a link to this recording in case you didn't record it locally. You can look for that later today or tomorrow morning on our news page. So again, thanks everyone for joining us. Thank you all, and enjoy the rest of your day and be well. Thank you.
Thank you.
Bye-bye.